Hello, my name is Dr. Michael S. Kallos, and I'm a faculty member at the University of Calgary and Director of the Biomedical Engineering Calgary Initiative. In this presentation, we'll talk about the biomedical engineering response to COVID-19. So we have a research strategy spanning multiple faculties at the University of Calgary called Engineering Solutions for Health. And that strategy really played a key leadership role in the University of Calgary's COVID-19 response. And so our activities started almost immediately when the province said that we all had to go and work from home. And that was March 5th, 2020, with the first COVID case in Alberta. We were working home about a week later. And this chart really shows the level of activity as we started coordinating and tracking multiple different projects across multiple different disciplines. And we realized shortly, a few weeks in, that we really needed to coordinate this a little bit better. And so we started offering weekly biomedical engineering and Innovate Calgary Ask and Offer sessions, where we would host a Zoom meeting and have anyone that needed anything or anyone that had a skill or a lab or a supplies that they could offer would be able to get together and combine those efforts and form teams around different types of problems. And so we were constantly getting requests for new projects and requests for different kinds of expertise. And this weekly session really helped to coordinate those types of things. And at the end, when the government started launching programs for funding some of these initiatives, we had a number of partnership grants led by Schulich, led by other faculties, and looking at industry partnerships and COVID-19 grants, and a number of those were funded at the University of Calgary as well. And so we had almost 90 faculty members and student leaders involved in these different projects across 10 different University of Calgary faculties, 42 projects we were coordinating and tracking throughout the response in 2020. It resulted in 27 new grants and really partnerships between industry, Alberta Health Services, and the University of Calgary, and almost $5 million in new funding out of that. And there were a number of key clusters of activity, which I'll talk about in a second, in a number of different areas. And so this figure really shows one of the tools we use to help track and coordinate, which is Kumu. It's a website that is used to map networks. And this really shows the University of Calgary faculty members and staff that we were trying to organize, folks from Alberta Health Services, as well as industry at a number of different companies. And really what we were involved in was taking these projects and taking these people and grouping them into a number of different projects and helping them to align and combine efforts. One of these efforts was a student-led effort in supporting mental health and community during self-isolation. And this is a group of students involved called NeuroNexus. They ran a multidisciplinary health hackathon and had a number of competitions and ideas around community health and supporting the community during the pandemic, all offered virtually, of course. The number of research projects and support projects for the community were also run through biomedical engineering. The main categories here include diagnostics, PPE and consumables, digital technologies around artificial intelligence and machine learning, therapeutics, as well as ventilators. And so under the diagnostics, there are a number of different projects that were started and are running, including different kinds of detection around proteomics, different sensors and swabs, PPE and consumables. There were a number of efforts around face shields and hand sanitizer and a number of other different things. In the digital realm, there were different types of technologies that we were looking at for remote vitals monitoring and cloud data and contact tracing. In the therapeutics area, a number of different cell-based analysis or therapeutics type technologies. And in ventilators, a number of different researchers working on both positive and negative pressure, and we were participating in a bigger initiative around that. And so I'm going to give a couple of examples of some of these projects just to give you a flavor. So this is one that falls under the diagnostics heading, and this is a rapid ultrasensitive clinical detection of COVID-19 led by Dr. Amir Sanadi Nazad in the Schulich School of Engineering, but involving a team from veterinary medicine as well, and the team is listed down here. And they were funded by a CIHR operating grant, and are working to finalize the development of their technology. Another group led by Milana Trifkovic involved a local startup company that she's involved in called Envicor, and they pivoted rapidly to produce hand sanitizer. Remember last year when hand sanitizer was in very short supply, and a number of different industries pivoted to help supply that, and they prepared theirs and donated it to several not-for-profit organizations. Another project we were involved in that is spanned multiple faculties as well as industry and Alberta Health Services was a positive pressure ventilator project, and the creation of the Alberta eVent, also known as BERTI. The UCalgary leads were Craig Johansson and Sean Gare, and they worked with part of a team to produce 200 emergency ventilators in about 6 weeks to meet Alberta Health Services' immediate needs. And so this included grad students, it included companies like Exogy Solutions, Logican Technologies, and generous funding from Suncor. And they actually had Health Canada approval and produced these ventilators and have delivered many of them to Alberta Health Services. Another more research-related project involved faculty members from nursing, kinesiology, and engineering. Linda Duffett-Legere, Reed Ferber, Roman Shore, and Amir Sanati Nazad were looking at remote patient monitoring as a tool to lessen the burden on the healthcare system. And they had funding from an NSERC Alliance grant looking at using smart phone centers and activity trackers for remote monitoring and screening. Another project funded by NSERC around AI, ML, and digital applications was led by Mia Wang from the Faculty of Science, and she is leading a project looking at smart cloud applications for COVID-19 prevention and control. And they're looking at combining data from a number of different sources using machine learning to analyze that, and then trying to predict outbreaks. This is a partnership with Alberta Health Services as well. So really this work is built on a foundation of many years of faculty members and students working across disciplines in teams. And so the Biomedical Engineering Initiative as a whole has been running for 25 years with a multi-faculty biomedical engineering graduate program. This is a partnership between 6 different faculties: engineering, medicine, kinesiology, vet med, science, and nursing, that have supervisors and supervised students within this program. There's a number of training initiatives at the undergraduate level, including a minor in the Schulich School of Engineering and a new bachelor's degree we're starting in fall of 2021. And this research strategy, which really brought a whole bunch of more faculty members from across these faculties and many others under the Engineering Solutions for Health Biomedical Engineering Research Strategy. And you can always learn more by going to our website. I have to put a plug in for ucalgary.ca/BME. And this is just an image showing the network that we had built before the pandemic of researchers across the multiple faculties, and you can see the faculties labeled in the colored ring on the outside here. And then each name around here is a faculty member with their lab and their students, and the lines here connect researchers that are working with each other. And so there are so many links between members across these different faculties that have provided a basically running start to when COVID hit, that we were able to take advantage of these relationships and this network to really hit the ground running when COVID started. So as I reflect back on what was really a rapid response to COVID-19, as I mentioned, I think this collaborative cross-faculty transdisciplinary network that the University of Calgary had set up really allowed us to move rapidly. And we knew people with the expertise that was needed and could contact them and call on them right away. There was fantastic support from BME staff, so Carmen Reeder was amazing and absolutely essential for this project, and many in the Vice President's Research Office in Innovate Calgary and beyond across campus. There's too many to mention here. And what I would probably do a little differently or wish that we had for the next, hopefully not pandemic, but next crisis or opportunity or challenge is really an online portal to really help us collect some of the needs and some of the abilities and connect them in a more streamlined way. Our weekly Zoom sessions worked really well for the time, but I think we can definitely do better. And then some integrated software to track projects, to track communications and progress will really help us keep on track of 42 projects rather than using email and spreadsheets, which is the main tools that we used at the time because we were just going so fast. So final remarks, I really think that the University of Calgary's Biomedical Engineering Initiative played a key role in part of the university's response to COVID-19. There have been a number of exciting new partnerships, new researchers brought to work with each other in opportunities, and we are always happy to hear any more suggestions or any feedback at bme@ucalgary.ca. Thank you very much.